Are you having ongoing thyroid issues? Maybe you're feeling fatigued. Maybe your thyroid medication is going up and down every other month, and you can't figure out why that is. Perhaps you recently got diagnosed with Hashimoto's thyroiditis, and you want to know what this disease actually is. My name is Dr. Terranella, and in this video, we're going to cover what is going on with Hashimoto's thyroiditis, how does it happen, and what's actually underneath this disease known as Hashimoto's thyroiditis. As I said, my name is Dr. Terranella, and if you're new to this channel, I just want you to know that I'm making these videos because I enjoy helping people go beyond just the basics of their health, whether it's a confusing health symptom, diagnosis, or lab tests. I enjoy helping people get a deeper understanding of what's going on with their health. So if you like this kind of information on hormones, nutrition, and overall health optimization, click on that like button and don't forget to subscribe to the channel to get more videos like this one. Now for a quick disclaimer, the information in this video is for informational purposes only. It's not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deeper your understanding of your own health and treatment success. If medical attention is needed, don't delay in seeking that attention. All right, let's connect the dots on what is Hashimoto's thyroiditis. So what is Hashimoto's thyroiditis? Well, first of all, thyroiditis is inflammation in the thyroid gland. And this happens when the thyroid gland becomes irritated or inflamed for one reason or another. Hashimoto's thyroiditis happens to be the most common form of this health condition, this thyroiditis, and it's caused by your immune system attacking the thyroid tissue. When it does that, it causes irritation, and this immune action against your own thyroid is referred to as an autoimmune disease. So the first thing in answering this question, what is Hashimoto's thyroiditis, is it's an autoimmune disease. And this occurs when the body's immune system makes a mistake. That's right, it makes a mistake, which begins by the immune system making antibodies that are going to attack the cells or tissue of the thyroid gland. Why would your immune system do this? Now, of course, your immune system isn't conscious or have its own thoughts, and so it's not thinking that it actually made a mistake. And the exact reasons behind how and why this happens aren't clearly understood. It's thought to be tied in with something known as molecular mimicry. The principle behind molecular mimicry is that the immune system makes a mistake when it's trying to basically make an antibody against a molecule that is something foreign, different than self. So the idea is that there's a bacteria or viral proteins that have a similar molecular structure to the proteins of the thyroid tissue. Not just any thyroid tissue, but the specific molecular structure of that antibody that's actually attacking your thyroid. So when the immune system is trying to make an antibody against a foreign invader, perhaps like a virus or a bacteria, it makes a mistake because the protein on that virus or bacteria looks very similar to the protein on the thyroid tissue. It may only be a couple amino acid difference in those two molecules, but when it makes that mistake, once that happens, and that immune cell that's making those antibodies then divides and proliferates, now you have Hashimoto's thyroiditis. And once that process begins, it's not very easy to unwind that process. That doesn't mean it's impossible. And there are ways to calm that down and reduce that autoimmune activity. It just takes the right approach and persistence. Now, back to our story on what is Hashimoto's thyroiditis. So because your immune system is having this ongoing attack on the thyroid tissue, the immune cells and inflammation that's occurring there interferes with thyroid hormone production. That thyroid gland then can't produce enough thyroid hormone to provide for the whole body to keep the metabolism going and do all the things that the thyroid hormone does for our bodies. As a result, people with Hashimoto's thyroiditis end up with an underactive thyroid, also known as hypothyroidism. And in some cases, initially, there may be a increased activity in the thyroid, and that's known as Graves' disease, and it's hyperthyroidism. But that's usually temporary and usually flips into the hypo state within a few months, possibly even a few years. Whether it's hypo or hyper, usually people will take medicine to kind of regulate these high and low levels of thyroid activity. Now, it's also possible to have Hashimoto's or autoantibodies against your thyroid and not have abnormal thyroid hormone output. But once your immune system begins to make these autoantibodies against the thyroid tissue, your day-to-day thyroid output can vary up and down depending on what's going on with those antibodies. So that the symptoms that you're having when you have Hashimoto's thyroiditis from one day to the next may not be very predictable. So what are Hashimoto's disease symptoms? That's what we're going to look at in the next video. Okay, how'd I do? Did that help you better understand what is Hashimoto's thyroiditis? If it did, great. If you still have other questions about what this disease actually is, or maybe something in the video needs to be clarified, let me know in the comment section. Drop your questions and any additional things you would like to know about in the comment section. We'll see you next time. Thanks for watching.